In a bid to strengthen Uganda's public health sector, the US government, through the Center for Disease Control, has trained 17 medics in the field of epidemiology. These were equipped with hands-on skills in disease surveillance, control and data analysis and interpretation.
Epidemiology is now more important than ever with emerging and re-emerging diseases. We've heard somebody mentioned Ebola, COVID-19, yellow fever. I read in this morning's paper about sleeping sickness as well. And so we need more skilled professionals like you in public health.
About surveillance being the backbone of everything we do in public health. We expend a lot of resources, human, financial, and time resources, collecting surveillance data, and without having high quality data, understanding those data and using those data, very little that we do can be done very well.
While officiating at the pass-out ceremony in Jinja, the US ambassador to Uganda, Natalie Brown, urged the trainees to use the skills received to study non-communicable diseases, which are a threat to many communities.
I'm also aware that you worked on investigations in non-communicable diseases such as diabetes, malnutrition, and many other equally critical health challenges in our communities.
The Commissioner of Health Services in charge of epidemiology and disease surveillance in the Ministry of Health, Dr. Alan Muruta, called for calm among parents as the country experiences an outbreak of severe flu during the April rainy season, especially among children.
And we had an outbreak of influenza type B, which is taking place in schools. And we expect it to get worse before it gets better, worse in terms of numbers, but we don't think it is something that we should be worried about.
The medics who were trained applauded the stakeholders for this initiative, since this training was worthwhile.
Specifically, it has enhanced our skills in using epinfo for data analysis. And we are currently able to do a lot of studies and also do a lot of publishing scientific audiences.
We are living with a wealth of knowledge. We need to appreciate that.
Elijah Tudiagmanawe, Hakim Kanyere, NBS.
Last year, around October in 2021, and it's a field epidemiology training program. It's under the National Institute of Public Health. It attracted several participants from 5 referral hospitals, that is Naguru, Kabale, Koima, Fort Poto, and some participants from Ministry of Health. We've learned quite a lot of things, which include outbreak investigation, data analysis, presentation skills, and scientific writing. During this course, we've had some field work where we went out and investigated some outbreaks, such as malaria outbreak. And also we worked on a field project which we presented today, and it was about hospitalized COVID-19 cases. This has been a very good experience, and we hope that the skills we have learned from here shall be able to use them in our current work. Most of us are already working. Myself, I'm working in Ministry of Health, National Malaria Control Division, and other members are working at regional referral hospitals. So we hope that they will be able to join already the teams out there which are in epidemic investigations and outbreak. Thank you. Of course, mainly has added our skills in outbreak investigation.
I wanted that clip when I was talking.
And evaluation of surveillance systems. Specifically, it has enhanced our skills in using epinfo for data analysis, and we are currently able to do a lot of studies and also do a lot of publishing scientific audiences. Yeah.
Thank you so much.
Good morning. Good morning. Good morning. How are you? Good. Nice to see you again. Thank you.
I'm very privileged to give you or share with you my experiences and what I've gained or learned in this 9-month period. At first, I thought it was giving me another burden, coming back to class, which was not in my mind. But when I came, I also thought it was normal, it was usual. But things are not usual. With my background, I thought epidemiology was just what I had learned at master's level. But here I got the field practice, what happens on ground. And with the case studies, case scenarios that we had, I got the feel of what I must or I should do on ground. Secondly, data analysis. I extended my knowledge on data analysis and interpretation. Of course, we do analysis at national level or individual projects, but my capacity on data analysis and interpretation has been enhanced very well, and there I stand confidently to tell you that I've gained that skill in data analysis and presentation as well. Presentation is not easy. By mere standing in front of you people, we could be fumbling and fidgeting to talk, but presentation skills have really gained on that. Writing an abstract. Most times, people write research works and so on, but coming up with an abstract has not been an easy thing for me, but now I've gained. Secondly, a fourth skill that I've gained is that investigation, disease investigation. Practically, I would now need or want to be involved more in terms of disease investigation. I've gained the knowledge, and I would not want to sit with that knowledge on the desk. Lastly, colleagues, I've got new friends and new comrades in the struggle. I had not known people from Fort Portal, I had not known people from Kabale. Now we can rub shoulders. Thank you very much.
Even now when you are doing nursing, it is part. And when we come to report writing, I could see how my colleagues and myself would fig it with coming out with a script, coming out with just an abstract. You think and you feel you are not thinking anymore. So when I was telling God that I just want to get something better in report writing, in coming out with a project that can be presented and cause public health action. And I just know that this is how God answered my prayer. And I thank the people who have made me to come to this time. So about the course, I can just give some vague experience. Yesterday, I was trying to go through my work. You know, when we are doing work, they always tell us, don't erase anything. Right from the first letter you wrote, save. Save, 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 save. So I went through my savings. And the first work I gave to my mentor, I realized so many crossings. The reds were very many, very many. And even me, when I read them, I said, what did I mean this? Because I could not know that I could write something better, not until I saw what I wrote first. And I said, but now, what did I mean by doing this? Actually, I realized that I'm getting better. First of all, in report writing. Secondly, even in knowing the use of data. At first we thought data is for only the records people. We could not appreciate so much what we do. Me like a nurse, we do the work, we write, and then at the end of the day, we just know it is the records who wants the data. But I've come to appreciate the use of data. That the work we do is more reflected in the data we give than the actual work we do. And it reminded me when someone said that work not documented is no work not done. So I just came to realize that most of our people think they are not doing much by writing. But I've appreciated the art of writing, that whatever you write is more of what you do than what you do and you don't document. The other thing I have appreciated is public speaking. Yesterday there was a hiccup. I can just bring it again. Public speaking was something that I could think that everyone can. But when yesterday I was giving my presentation, I was very confident about my topic. I knew it. And even the team who was in front of me, I was familiar. But as soon as I started, I made one statement. And someone I just looked at people's faces, and someone made a gesture, and I just lost it all. So I just appreciate that even if you've been very confident, you cannot be as the best, not until you have done it. Because I thought, those rehearsals of the scripts, you rehearse, you go to the mirrors, you go to the gardens, you take the recordings. I thought I had known it all, but it just when someone's facial gesture, it took me off. And by the time I thought of getting back, time was almost not on my side. So I'm just continuing to appreciate public speaking, that it is something that we need to continually practice, and I'm believing I'm getting better. There is a lot, but I can stop there. Thank you very much.
The perspective of the mentors, I think we are carrying on the Dr. Ario's vision, and aspirations of national public health capacity building, especially in disease, outbreak and response, which also is a docket that falls under Dr. Alan Muruta. So all these efforts actually make Dr. Alan's work a little bit easier if the capacity is more built nationally. It's been an exciting journey with the mentees, because they've been colleagues. It is, an in-service sort of program. So you're working with people who actually have a vast and wide experience into many areas. It's at some point you're actually not sure whether you are mentoring or you are being mentored, because depending on the area that you're discussing, you find it very enriching even on your side. So it has been a mentor-mentee relationship, but as if the coin keeps flip-flopping anytime. One day you are mentoring, the other day you are being mentored, because now you are in an area that is very completely new, and the supposed to be mentee is actually, better versed with what you're discussing. And we are very excited with our relationship we had with the mentees as the mentors. Because that has not in any way affected the way we have been dealing. You continued looking at us as mentors, we kept looking at you as mentees, and the relationship, it's very difficult to imagine that it has come to an end. Let it not end here. The program could have ended, but I think the mentor-mentee relationship, the comradeship we have built, should continue. We are in the same sector, and all of us are fighting a common enemy, and this enemy is disease. Want to fight disease out of Uganda, contribute to achievement of the National Development Plan 3, which is currently what we are chasing, and chase disease out of Uganda. So let this relationship continue. Let's continue mentoring each other, and the relationship continues.
William Atherwood, who once said that if you can imagine it, you can achieve it. If you dream about it, you can become it. There is also another gentleman who happens to be my friend, called Les Brown, once said, Shoot for the moon. Even if you miss, you will land among the stars. I'm glad that we've shot the moon and we've hit our target. Requires moment of tension. I'm glad and appreciate the moments of the course we've had together and with generosity and curiosity, and that's why we've come to the end of our course today. We have also been so determined and focused, and I'm sure we are going to make something amazing out of our lives. The world is a terrifying place, I know, and sometimes uncomfortable in it, but we have everything to become anything we want to be. We are finally graduating colleagues. I admire the strength of my colleagues and determination, and I'm beyond proud of everything that we've accomplished together. Theory is always fun, but it's time for practice. It's time to practice the skills we've attained in the training. Let's keep our heads up. Thank you for entrusting me as your president, and hopefully I've done my best through your guidance. We shall always remember this day as a wonderful day in our lives. We started these doors with nothing in terms of knowledge or something little, but we are living with a wealth of knowledge. We need to appreciate that. To our dear mentors and trainers, thank you for showing us how to stand our grounds and have the kind of career that we can be proud of. We count ourselves lucky having had your mentorship. You've been exemplary and visionary mentors and trainers. You have been great leaders who have dedicated your lives. We appreciate and treasure everything you've taught us. You've been an icon of integrity and hard work. This training has been extremely exceptional. To our sponsors and the head of FETP Intermediate, we appreciate your generous contribution towards this cause. The success of this event is because of your generous contribution. It's a dream come true that we were able to enroll for this prestigious program. Your generous contribution has helped us to achieve this silver and gold. It's really worth it. Thank you for thinking of us as capable candidates for your program. We feel grateful and humbled by your gesture, and we extend our gratitude and thanks. We assure you we shall make use of this achievement. To our dear directors from different regional referral hospitals, we would like to appreciate our dear directors for immeasurable support and entrusting us as the best candidates for this program. We assure you, directors, that this has not been in vain. We shall utilize this knowledge and for better performance in our respective hospitals. Thank you so much. Now that this is the first cohort of its kind, with very brilliant ladies and gentlemen, we would love that we be given an opportunity of advancing, because we know there is that advanced program. And we would also love to be invited for some scientific conferences so that we can attend and listen to presentations, but also get involved in such. With those few words, I wish my colleagues a very colorful and cheerful celebration. Thank you so much.
And the results that you demonstrated. Today here I saw a new dimension of working as a group. I can imagine 17 brilliant brains coming up with a project. I wish I was a fly on the wall, the arguments that must have gone into this project. But the product that you gave us was great. And I heard you saying that you are hoping you'll have a manuscript out of this. I am going to hold you to that. Please disseminate that and let everybody know what your project was saying. I thought it is a great contribution to the body of science. Dr. Ario, as the director of the Uganda National Institute of Public Health, you should be very proud of the team that you are producing. I have looked at the competencies in this program, and it aims to improve surveillance, data analysis and interpretation, outbreak investigations, and scientific communication skills. And I know that these competencies have benefited my program, which is the Monitoring and Evaluation Technical Support Program, for which I am the program manager. But before I go into that, let me tell you a little bit about my program. So METS is one of the projects under Makerere University School of Public Health, and we are funded by the US President's Emergency Plan for AIDS Relief, PEPFAR, through CDC. And currently we're in our second year of implementing a 5-year program. When Doreen said that their funding comes through us, it is true. Their funding actually comes through our cooperative agreement. And I must say that it is a pleasure working with the team, Doreen and her team, Stella, and they keep the program moving. I actually had one of the mentors also make mention of this. He said they are a pleasant team to work with because they actually do what they are supposed to do. So we do offer technical support to the Uganda Ministry of Health, as well as PEPFAR implementing partners. And basically our areas of focus are strategic information, basically country reporting mainly, data science and informatics. I know some of you have interfaced with the innovative dashboards and systems that we have in place. Disease surveillance and response, very closely associated with this program, as well as health system strengthening, which actually takes in account the regional referral hospitals. Now, under the CARES budget, METS in the last year or so has recruited technical staff to support the Emergency Operations Center at the Ministry of Health. I take note that all the positions we've so far filled have been filled by alumni of the Field Epidemiology Training Program. That should tell you something. And they have been very instrumental in supporting the COVID-19 response, surveillance activities, and ensuring continuity of essential services. To the best of my knowledge, and I'm yet to hear otherwise, they are performing very, very well. And I know that there are alumni among us here that can attest to that. And so Dr. Rio and Doreen and the team, we say thank you to you for a job well done. Keep it up.
The field epidemiology training, trainees at advanced and frontline levels, as you may know, this country has gone through a number of outbreaks, including cholera, including Ebola, and now COVID-19. This program has been on for a long time, and if it was not for the pool of trainees that we've had, I do not think that the country would have responded to this level. You may wish to know that Uganda has been one of the countries that have responded to various epidemics, not only COVID-19, very, very well. And no surprise that we have a pool of trainees that have undergone this program. You may also wish to know that it's not by mistake that you're drawn from regional referrals. Our current strategy is to make sure that the regions headed by regional referrals have got the capacity not only to prevent, but to detect and respond to disease outbreaks. And this capacity at the regions is intentionally built to make sure that the districts are mentored and supervised. So that's going to be part of your roles. I wish to thank Dr. Alex Ario, the Director of Public Health Institute, and your team for this program that we've run over the last couple of years. And I would like to congratulate you for the workforce that you have brought out for so far, working together with partners. Your Excellency the Ambassador, I would like to thank you in a special way on behalf of American people for the generous support towards Uganda, supporting the healthcare through various avenues, including this very exercise. Indeed, because of your continuous technical and financial support towards the government of Uganda, we have realized many achievements in pursuit of global health security. Your Excellency, I would like you to extend our gratitude to the American people. Back to the graduates, allow me to congratulate you in a special
pyramid, providing trained field epidemiologists across 3 levels of the health system. It's been exciting to watch your progress over the last 9 months under the excellent guidance of Doreen Gonahasa, one of our excellent FETP advanced graduates, and other staff supporting this program. It has similarly been very exciting to hear today about your group project and what you've learned along the way. FETPs exist in more than 70 countries worldwide and are meant to address the global shortage of trained disease detectives and improve countries' capacities to detect and respond to outbreaks. This is what most people think of when they think of FETPs, the response to outbreaks. But something that is perhaps less well recognized about these programs is that they are largely about understanding and using and improving data as you have learned, which is an activity that occurs mostly outside of the realm of outbreaks. In fact, we don't understand and use our data. We never know for sure when an outbreak is happening. If we don't know what we expect, we can't know whether the patterns we are seeing are normal or not normal. And we can't know what we expect unless we have high quality data that we know how to analyze. I think many of you might remember our early discussion in session 2 about surveillance being the backbone of everything we do in public health. We expend a lot of resources, human, financial, and time resources, collecting surveillance data, and without having high quality data, understanding those data and using those data, very little that we do can be done very well. I hope that this course has brought that issue closer to your heart and has inspired you to promote that understanding and those values within yourselves and within the work that you do. I know we are all hoping that the worst of COVID-19 is behind us. It's impossible to know right now, but I know that this is what we all dearly want. But even if it is mostly behind us, I know we are all aware that it's not going to be the last outbreak for any of us. Detecting and controlling epidemics will continue to be a challenge throughout our lifetimes. And as public health specialists, it's our job to be at the forefront of the response of these epidemics. Epidemics are difficult to prevent entirely, but there are many ways to reduce their impact, including finding them early, identifying the most affected areas and populations quickly, and implementing interventions to stop the spread of disease as soon as possible. By agreeing to become a trained field epidemiologist, by voluntarily enrolling into the program, you're also agreeing to be part of the public health leadership force that carries out these response activities and uses data to guide your decision making. Once you have entered the FETP family, we have high expectations for you. So beyond changing your own practices, You are now expected to go back to your host sites and help others use skills you learned here to improve public health more broadly within your work sites. I hope you know that you will remain part of the FETP family and that we will both reach out to you for public health support in the future. After a decade of working as an epidemiologist at the CDC, I knew that I wanted to devote myself to teaching and helping others gain the skills that I had been given by my mentors. But it was only through my work with FETPs globally that I truly began to understand the critical nature, not just of having trained field epidemiologists, but having trained epidemiologists across all levels of the health system to really be able to prevent, detect, and respond effectively. Uganda's advanced FETP began in 2015, and the frontline program restarted in 2022. The addition of the FETP Intermediate program provides field epidemiology training across all levels of the health system in Uganda. I know you all appreciate the importance of having a comprehensive system, and beyond this, watching our advanced level graduates run and teach this program and interweaving mentorship from and to fellows across other levels of FETP is particularly gratifying and strongly indicative of future sustainability, which is of course a primary goal of this program. It is a privilege to watch the program expand to equip the next generation of public health leaders with skills to investigate, manage disease outbreaks, and to improve health through service in Uganda. Now I would like to take a few minutes to recognize other people who have been critical to this program.
Thank the ambassador present here for always being there for us. I know I've never thanked CDC more than enough for what CDC has done for the country. But without the ambassador, CDC would not have done that. So I want to thank you, the ambassador. And of course, the American government, for all that you've done for us. We've moved strides because of the support that you've given us. I want to also thank the leadership of the ministry. That the ministry has been very supportive to the program. From the topmost, who is actually the champion, and that's the minister herself, to the director general, to the head of departments, they have all been very supportive to the program. I want to thank them so much, and they have made us actually achieve much more than we would have. So to the participants, to the trainees, I want to thank you for accepting to come and join the program. And I know you are different from what you were when you came. And please, when you go back, show the difference. Show that you've learned. Show that you can address issues better than what you were before. You have put in your request, and I think Doreen has answered you quite well. The time will come when you will climb higher. So thank you so much for achieving what you have achieved, and please receive your certificates in honor today.
Hospital representatives, representatives from the Ministry of Health, my colleagues from CDC. Of course, I have to acknowledge, as so many others have said, Doreen, happy to be here with you today on the special occasion for the graduation of the first ever cohort of the Field Epidemiology Training Program, intermediate level. I'm really happy to see you again after meeting you last August when we launched this program and commissioned you into the 9 months hands-on training from which you're graduating today. And I'm really glad to see so far in the remarks that like the enthusiasm and the dedication and the excitement that characterized all of you in August, that it's still very evident today, although maybe you're a little bit tired from all the hard work. So I look very much forward to seeing what you do with the training that you've received and the skills that you've developed and the impact that you have in your communities. So the United States has now worked with Uganda and the Ugandan people for almost 60 years to build a more democratic, prosperous, and healthy Uganda. All of us deserve to live long, healthy lives and have an adequate health sector staffing is critical part of ensuring this. And one of the reasons that all of you are here today is because we very much believe in investing in people. Uganda's greatest resource is its people. And I think by helping you to develop the skills so that you can serve your broader communities, I think is the best investment that we can make of the resources of the American people. And a key aspect of that investment is in the public health system and training local public health professionals to help their fellow citizens in the community to prevent, detect, and manage disease outbreaks. Through U.S. government agencies, specifically the CDC, which is so vital to the field epidemiology training programs, the United States invests more than $500 million annually in Uganda's health sector. This funding supports in-service training programs in collaboration with the Ministry of Health and other implementing partners like AFINET, so thank you very much. In the early 2000s, we focused on honing HIV program management cadres through a 2-year HIV programming and leadership program that nurtured many of Uganda's public health leaders today. And as you heard from Ms. Okello's remarks, many of them have moved into senior level positions in academia, in government, and non-government organizations. And I look forward to seeing where all of you are 1 year, 2 years, 5 years, 10 years from now in the leadership positions that you take on. But as you know well, health service staffing shortages, especially in field epidemiology, are all too common in many low-resource countries. And we therefore strategically expanded the field epidemiology training program from the 2-year national level advanced FETP program, whose graduates are here with us, to include this 9-month regional level program, as well as the 3-month district level FETP. The FETPs aim to improve a country's capacity to respond to public health emergencies across different levels of the health system. And this is the purpose of the FETP pyramid, which strengthens the entire health system in Uganda, enables more rapid detection of and response to disease outbreaks. The expansion of the 3-tiered FETP in-service training fills critical health staffing gaps. As such, it's so rewarding to see yet another group of skilled and talented healthcare professionals in Uganda sharing their experiences in the much neglected fields of surveillance, data collection, data use, and outbreak investigations. So I have no doubt that you made a wise choice to join this program, and I hope that you'll keep the passion and take the same path of growth into your careers as so many proud alumni have already demonstrated. And just to illustrate that, I'd like to again highlight Doreen. As you all know, a graduate of the Advanced FETP program, who has ably coordinated this program. And I understand that she led the rollout of this program to strengthen capacity within regional emergency operations centers and hospitals to collect, analyze, and use epidemiologic data for emergency response. Doreen has also collaborated with the staff of the Frontline and Advanced FETP to enable cascaded mentorship across the different levels of the program. And this is a commendable approach. It's a key aspect of the pyramid model and the training, and it provides sustainability across all levels. And Doreen, very much thank you for all of your hard work, for your dedication, your leadership, and your strategic thinking. Field epidemiology is now more important than ever with emerging and re-emerging diseases. We've heard so many of them mentioned: Ebola, COVID-19, yellow fever. I read in this morning's paper about sleeping sickness as well. And so we need more skilled professionals like you in public health. I've heard that fellows in this cohort worked on a group project to understand more about management of COVID-19 cases in your districts, and you helped make improvements. Your efforts during and after this training will strengthen Uganda's ability to detect and respond to public health emergencies by providing critical, timely data to inform the response. I'm also aware that you worked on investigations in non-communicable diseases such as diabetes, malnutrition, and many other equally critical health challenges in our communities. I could just say, like on the subject of COVID, it's nice to look around and see that we can enjoy each other's company today, mostly maskless. So that's, today is very different from when we met last August before vaccines were widely available, when COVID-19 was a very serious threat and taking so many lives of people who are involved in public health. And just say, hopefully it seems like maybe things are trending in the right direction, but I think done. I hope you continue to encourage those around you to get vaccinated. And we know vaccines are safe. We know they save lives. The United States has so far made available just under 16 million vaccine doses to Uganda, and we're intensifying efforts with the Ministry of Health to make sure that vaccines reach all of the people who have not yet had the opportunity to be vaccinated or boosted. And I count on you to do your part in that role. And I also want to acknowledge the generous support of your workplace supervisors who allowed you time to attend this program and conduct the activities and fieldwork needed to strengthen your skills. So thank you for allowing your staff to take part. The dividends from having more skilled staff in public health are immeasurable and will greatly contribute to our shared success in the work that we do. So please, as you've already been tasked, share your experiences with many others in your line of work beyond today to encourage more committed public health professionals to benefit from the program. And once again, in closing, I am appreciative of the strong support and collaboration of the Uganda Ministry of Health, the National Institute of Public Health, the CDC staff, and the many others who have enabled this important program to move forward. And to all the graduates, once again, I thank you for your commitment, for your dedication that you have shown in improving your own skills so that you can better serve your communities. A 9-month training program like this involves not only didactic training, but a substantial amount of field work that is highly challenging, especially for people who are already busy with full-time jobs and family commitments. So to succeed in this program is evidence of your dedication and the commitment. And I am so appreciative of all that you've done and what you continue to do. And I again extend appreciation to the mentors, the work supervisors. Congratulations.
Chimoli Ronald. Dr. Kefa Batra. Mr. Male Ronald, the male one. Mr. Chibuka John Matthew Zeng. Where are the products, sir? Miss Musene Rebecca Beatrice. Mogisa Nyangoma Regina. Miss Nasaka Fatia. Post-birthday.
Presenting, you're picking for Dennis.
As we signed our board, the team had, they would like to say something, so I think they can use this opportunity.
We don't want to take a lot of time. Small gifts, and just they show the appreciation on our hearts, and just know it is from everyone on our hearts, and we believe it also.
Let's see. Yeah, let's see. Is that everyone? Yeah, we're oh wait, someone's hidden. There you go.